Welcome to the Monday, January 10th, 2022 Board of Health meeting. Present we have myself and Lisa Lessiger, as well as Sue Malloy and Jean Marie Kent. I always mess this up, Jean Marie.
I won't take offense. Don't worry. Jean Marie Kent Joyce.
Jean Marie and Joyce. We'll start tonight with an appointment with Eddie and Maria Chapa from Sacred Edition Tattoo and handling their application for renewal. Okay. Jean Marie, can you give us any background on this? On the appointment?
Not a ton. I haven't been here. I've only been here 2 months, so I don't know that much about it. But apparently, you have sent emails out, and you have the dates, Matt.
Yep.
Underneath, reminding you to renew. One of the reasons we do that is so that everything comes in December 1st. We then have a month to catch things up, to get any certifications we need, the whole process. If you don't have a permit by December 31st, you are then automatically closed and send a notice. And I think we followed that procedure, and someone signed for it at Sacred Editions. So that's one of the reasons we're here, because we have to examine, look at and make sure all the certifications haven't expired, all the vaccination status is current, and that we have all the education needs that we have to have. So that's where we're at. You have a permit for the establishment, and we have inspections that have to be done for that, and then we have applications for the practitioners and requirements for that. So that's where we're at, Matt.
Okay. Sue, do you have any more background?
No, just obviously, we sent out the letters back in November for renewals. I did email and remind them. I think I gave you copies early December. Then once the deadline had passed, I think we actually gave till December 10th. That gave us, I think our last meeting was December 20th or 21st, around there for the year. So just letting them know that was our last meeting of the year, knowing that this board didn't issue permits outside of meetings, that we had to get it in before the meeting. And so we did not get a reply to those emails or to get the applications in time. So at your last meeting, when we didn't have them, those were the only establishment permits we were waiting for in East Bridgewater. You guys asked me to have them come to the next meeting.
Okay. Where do we stand on this process now, guys?
We turned in everything.
Everything today.
Everything has been turned
So
in?
the original applications did, Jean Marie, I think, got them January 4th.
January 4th.
Okay.
And then they were just missing some things that they did come in today with some certifications.
So all the certifications are outstanding right now?
So no, we have one person that we would have to, if you did vote to do anything tonight, we have Anthony Colon. I do not have his current certifications yet, so I did leave him a voicemail today. I understand maybe he was out sick or something, so, yeah. So I did not, so that would just be on hold until he needs to update things like CPR, first aid, bloodborne pathogen certifications.
Okay.
Has the inspection been done, Jean Marie?
No, because
Not yet.
they haven't been open.
Okay. So are we aware if Anthony has those certifications, or does he still have to get those?
His CPR and his first aid, I should have a copy of that in his file. His bloodborne, I haven't checked with him. He hasn't been in since probably like, I
I
don't know.
think he had caught COVID, and then he had a hand surgery and stuff too,
Yeah,
so he
hasn't really
been
been into the shop for a while. He's the only one who's been there. We usually leave like in the first week of December, and we go to
Yeah.
California because we have family there.
We just
so
barely
we're
got
gone.
back.
We just barely got, yeah.
Okay. I got a couple notes here. There was a dog on premises.
Uh-huh.
Is that dog still on premises? 'Cause
Yeah, can he not be?
Okay, do you have a copy of the regulations?
Our recent, I should have them.
Yeah,
in my
we only
file,
have
yeah.
one, yeah, we only have one. We've never changed them.
It's pretty obvious. No pets allowed except, for some reason, fish tanks.
Okay.
Oh, okay, yeah.
I didn't know that, but yeah, that's fine.
Okay.
It's not a problem.
And also, may have been an issue with your front step, whether it was ADA compliant. That's the Americans with Disabilities Act. It needs a handrail. Has that been taken care of?
Okay, so, yeah. We
It's
don't-
because that's part of, the only reason why it's kind of been off and on is when we first bought the shop, we built the stairway and everything, and then somebody crashed into it and damaged
Oh,
the
no.
whole thing. And it's been taking the landlord, because it's his responsibility, because I guess that's part of his thing
Okay.
that he pays for. So
I guess
we
like
have to
the
kind of
outside.
wait on him to fix that outside part.
Do you have a second access that's ADA compliant?
Yes, the back stairway.
Okay. So the dog and that back stairway is fine, we just can't
Yes.
have the front stairway open, and then we need an inspection?
Yeah, we need inspection.
Okay. Did we ever get, you guys were asked for some COVID compliance stuff? Did you ever send in a plan for COVID compliance?
No, I don't think
I
we
don't
did.
No, we never,
We didn't ask one. There's a note at the bottom here about, you know, who's, what their plan is for a practitioner is positive for COVID, things like that.
I think Jean Marie just was.
I put it on because you're supposed to be, you're supposed to know about current contagious or infectious things, especially recently.
Yeah,
So we're asking you, what is your procedure if a practitioner's positive? Because you would meet the definition of being in close contact with someone. You're within 6 feet of them, and you are there for more than 15 minutes if you're doing a procedure or body art on somebody. So my question to you is, what is your written procedure to take care of that? One, if the practitioner is positive. The other one is if you were notified within 2 or 3 days that a client was positive. Those would be two different things.
Well, normally we would have like me either a sign-in sheet if we have anything like that with the COVID. We haven't had any artists that had any problems like that, except for Anthony recently, but we would most likely get in touch with any of our customers, reach out to them and let them know. I'm pretty sure Anthony is vaccinated, so I'm pretty sure he's fine.
Well, the current thing now is and to take it out of your realm and into ours, if, for instance, I work with Sue, if Sue or I were positive, I would have to notify her she's a close contact for me.
Would be the customer.
I would have to stay home, even though I'm vaccinated, I would
Yeah.
stay home for 5 days.
Yeah,
And then I would double mask because
yeah,
COVID is being COVID, for 5 days.
Yeah.
So that would need to be probably in writing in the language that you're all familiar with.
yeah.
Not everybody speaks English well, not everybody speaks Spanish well, or whatever. So whatever language you use to communicate, and put it in that language so that they know they have to go to this procedure and do this.
Okay.
The practitioner is responsible for notifying any close contacts. So that would be what we would expect you to do. But it's just because you know darn well when something happens, you need to know.
Yeah,
It's better to have it in
oh,
writing.
for sure.
yeah, yeah,
Sure.
yeah.
Just for your own assurance.
Yeah. We haven't had any problems at all at the shop since we,
With
At
the
all.
COVID, yeah.
I
the
get
COVID
that,
at
but
all.
we're going in a surge
So-
right now.
Yeah.
So,
We'll talk about that tonight, too.
We're pretty careful and stuff like that, so.
right.
And when you
usually
guys,
I was just gonna say, I will just add it, and, you know, to their credit, during COVID, over the last 2 years now, Maria has kept in contact to check with, has any regulations changed?
Right.
Oh, excellent.
When they were closed, when they could open, so they have been kept in touch to make sure they were up to date on all the COVID guidance, and honestly, I think they actually, at some point, when they could have people in, they actually delayed it for a little while. So, you know, as far as COVID goes, you know, to their credit, they did take it very seriously.
yeah,
All right.
So was there a particular reason why everything was not in by the deadline?
I left it with my son. So he helps run the front end. Normally, at this time period, I don't have, normally no artist there. It's usually just Anthony off and on, so he doesn't have like a giant responsibility. But I gave him the paperwork to turn in, and he
like
forgot.
3 weeks before we left and he just
Yeah.
didn't. do
I mean,
it,
I
so.
can't make any excuses for my son. He's
At
20.
the end of the day, it's just our fault at the end
Yeah.
of the day, so. He's just basically our
When
employer.
when I
so.
asked him about it, he was like, "Oh, I forgot." I was like, "Oh my gosh."
Yeah, so.
Nobody was here, so I just had him come in anyways
Okay.
and drop off the paperwork and,
And the guys that I work with are all these pieces of information that we usually need every year. All of us actually are usually on top of it all the time because we do tattoo conventions every year. So for those things, they also require all these
Yeah.
things that you guys are asking for. So,
yeah.
you know,
It's just fell a little short with
Yeah, we
leaving
just-
my son responsible for it is all.
yeah, we just got back 2 days ago, so.
Jean Marie, how long would it take what would an inspection entail, and how long would it take to get one for them?
I actually got this for them because I'm going under the assumption that you may not have seen the inspection report before. or haven't seen one of these before, so that you can go through it yourself and see, just to highlight what you might need to take care of before I get there. And that was the thing that, was most concerned. Most of it, a lot of it has to do with what we just did. You have to post, you have to have disclaimer statements about, what to do if they're under 18, do you get the parent's signature, that kind of stuff.
We don't
We don't do
don't
any of
accept
that.
nobody under 18,
Okay.
so. So we don't
Occupancy
have to-
permit, which we usually get anyways, establishment permit, practitioner's permits, record keeping, establishments, client information, exposure control plan. Do you use an autoclave, or are you doing
No,
single
no.
use? Okay.
All
Everything is
disposable.
The physical facility, client waiting area, adequate ventilation and lighting, how to clean up, procedure area, single-use, sterilization, sanitation, and standards of practice. And it's all pretty,
Yeah,
if you've been there, you kind of know.
yeah. Well, since I took it over, I've already had the shop for like 2.5 years, I think. Like
Right.
I redid everything. Like everything's new in there, repainted. The whole front we redid. Like
All
everything's
needs to be
new.
redone.
So
Now,
I
do you
redid everything since I've owned
do you
it.
have set hours, or are you only open by appointment?
No, we used to have set hours. We open from 12 noon to 8, and 12 to 9 on the weekends.
But for the
Okay.
most part, it's appointments only.
But it is mostly appointments only.
That's how a lot of people are doing it, yeah. Yeah. Alrighty, so we can just talk and make an appointment for me to go in there and do the inspection
Mhm, mhm.
and get that squared away.
Sue, when's our next scheduled meeting?
We have to talk about that tonight, but
Okay.
it probably, at the very least, it'll be 2 weeks, so.
2 weeks, okay. So, how long would it take to get an inspection? Are you guys ready for inspection, or do you guys want time?
No, we don't need, I mean, everything's pretty much done, right? We have all our records and whatever you guys need, we have it there.
I think the only question you might want to lean on your landlord is probably ADA compliant from the front.
On the railing.
Mm.
Yeah.
Okay.
So that's something I would do in writing via email or letter, because if he is not forthcoming with getting that repaired, you can file a grievance with us, whereas you're a tenant, so that's where Board of Health can step in
Okay.
to assist
Okay.
with that,
Okay,
where it's affecting your business.
okay.
So I think we could probably get it done this week. Probably, tomorrow's a little tight, but Wednesday or Thursday.
Okay,
You can call and let me know what time's good.
okay,
Plan about maybe 40 minutes to an hour.
okay.
Does Rob have any questions, since he's right there on the phone?
Rob, you hearing us?
Yep.
Got any feedback for this?
So we think that we can get this inspected this week, if that's what I understood you to.
Yep, that's what I'm thinking. Yep, and they're agreeing.
Okay.
All right.
So if everything else is in order, we've done this before, where we can, approve with, tentatively upon the inspection being completed successfully.
We can, but we're still waiting on paperwork from at least one,
We would just not issue his permit. That would be tabled to the next meeting.
oh,
Yeah,
we
yeah,
cannot issue a
because
permit?
there's your individual
Separate them
permits.
out.
So there's an
Okay.
establishment permit, and then there's practitioner permits. And the practitioners are specific to an establishment, so
Okay.
he would
All right.
just get it when he gets his stuff in.
Okay, a lot of that I did not get.
One of our practitioners does not have all his certifications submitted to the board. So we're separating out the establishment, the physical establishment getting their permit from a practitioner's. There are 3 practitioners.
Right, so the practitioner that doesn't have the information in, is not certified or current, is not allowed to practice,
Right,
correct?
right, correct,
That individual should be noted as excluded.
right.
They're individual permits, so.
And Jimmy, are you gonna give them a copy of that inspection report, right?
Yeah, it's right here.
So, we're gonna give you the answers to the test,
Yeah,
okay?
make sure they're done, yeah.
Lisa, do you have anything?
No.
make a motion to allow Jean Marie to inspect it and grant them their permit if they pass inspection.
Great. Motion.
Okay, seconded. All in favor? Aye.
Did you hear
Opposed?
that?
No.
Right.
Okay, Matt made a motion to grant them the establishment permit upon satisfactory inspection. Lisa seconded. So they voted it.
Okay, so, so now, okay, so we're past the discussion stage?
Yep, we already voted.
Yeah, is he here or is he just listening?
Listening?
Are you here or are you listening?
No, I'm here.
Oh, okay, so then we're in discussion stage then. We can't vote unless he's, if he's here.
We're in discussion phase.
Okay.
Does he have more discussion?
Do you have any more discussion?
I do not, no.
Okay,
Okay,
hearing no discussion. All in
Gonna vote.
favor?
Aye.
Aye.
Aye. Opposed?
Nay.
All right.
So I would email the landlord and also just let him know that you need a handrail to be ADA compliant, and then that doorway, when you are reopened, cannot be used because of liability. So you'll just have to let them know they have to come in through the other stairway.
Okay.
And then if, if he gives you any resistance or is hesitant to comply, then you can file a grievance with us, and then we would intervene.
With the building inspector
Yeah.
also, I would think,
Yep.
yeah.
the building inspector takes care of those, yeah.
Okay.
All right,
So you guys
we're
are
all
good?
set. You guys
Yep.
good?
Just make sure you take that with you because you're gonna want that.
Okay, cool.
Stay sheet.
Yeah, because a lot of it is like posting posters
Yep.
of stuff.
That's the stuff that
rules
gets, that'll
that
trip you
people
up.
can see
Okay.
visual, you know?
Okay.
And if you don't have them,
The
then you would
regulations
have
are
to get.
online,
Yep.
so if you need to refer them.
Hmm? You have had one before, yep, I'm not sure if it'll be as thorough, but yeah, you should have had one before, yeah.
So if anything,
Yeah.
I probably have in my
I think
file,
when
just
you,
kind
when
of
you
look
brought
at
it from Charlie, I think they had a pretty thorough inspection, if I
Yeah,
recall.
they have an
Yeah,
inspection.
yeah,
They fixed a
yeah.
couple things in the
Yeah,
beginning.
you
Yeah.
fixed a bunch of
But
things,
even
yeah.
since then, like, I like redid the whole.
Yep, okay.
Some things are not even like structural, it's more like
You have to wait.
posting things, like
Yeah.
almost like when you work at a job and they
Yeah.
post like the workplace violence and all those kind of things in your break room, it's
Yeah.
more or less just to have it available for people
Okay.
to see.
Okay, cool.
All right, just give me a call. I would probably like to do it Wednesday or Thursday, okay?
Okay.
All right.
So I
Where- where-
I would probably
where-
say Wednesday would be better.
She's already got appointments
Our-
scheduled.
Our life kind of depends on, that shop opening or not. Like,
Okay.
We
Yeah.
really don't make any financial.
So what
decisions
time
for
do you
that.
open on Wednesday?
I can be there whenever you want. I live 7 minutes away.
Oh, all right, do you want it like 1 o'clock
Yeah.
or 12 or somewhere in there?
Yeah, early, as early as possible, yeah. we
Oh, as
can-
early as, well, I mean,
Yeah, we can be there, we get up at,
We're
we're
coffee-
old, we
we're
get
early
up
coffee
at 7 in the
drinking
morning to
people.
have coffee, so we can
Not
meet you there
the other.
anytime.
Wednesday.
Whatever suits you, but we're
It's
there
just
from
'cause
12
whatever's gonna
to.
help us open.
I'll think 9:30 then,
Okay,
and
cool.
if I have to change it, I'll call you.
Okay,
Okay.
perfect, sounds good.
All right,
All right, thank you.
Thank you.
Thanks, guys. Do you want to read off the rest of the warrant? So we go.
Okay. Are you here for?
So he's here for our discussion item number 1.
I have one question.
Yeah, sure.
So basically, we can't like work until you guys do your thing?
Until it's
Right.
Until we're
completed, yeah.
Yep.
Thank you.
All right, so next on the agenda is action items for approved disposal work permits for 692 Winter, 89 North Water, 38 Ashley, which was revised, and Lot 2, 3, 4, 5, and 6 of Daisy Lane, which we also have somebody here for one of those.
No, they're not here for Daisy Lane.
Oh, they're not for
No,
them?
they're here for the beavers on the discussion.
Oh, okay.
Discussion, yeah, all right. Okay, we don't have anything in front of us, Jean.
So I did forward you the reports if you just
Oh.
want to peruse them, but they, Jean Marie can give you a lowdown.
My phone's
no, I
doing.
can't, because I didn't.
Anything particular pop up, Jean Marie?
Nope, lots,
So we got 2, 3, 4, and 5, and 6 Daisy Lane are all new.
they're all new, so there's no variances.
Okay. And 38 Ashley was revised.
They moved the wetland line. That one does need some variances.
Okay.
Variances to be within 33 feet of a wetland.
They, but they granted those, we already previously approved that, and they granted all that, but then it went back, remember we granted it with pending conservation approval?
Right, that's where it's at.
Yeah,
Yeah.
okay.
They had,
So then it came back from, so this is the revised plan
So
after
we
they
have
went.
no issues with these work permits?
no,
Okay.
it was just in case they moved that wetland line since
Yeah.
we were so close to it.
Right. I'll make a,
Motion.
I'll make a motion to, accept them all, approve them all as written.
Second?
Stating on the plan? Yep, that sounds good.
Any discussion? All right, hearing none, all in favor?
Aye.
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 Why am I voting?
Okay.
Opposed?
Nay.
All right, that, checks that off.
Action number 2 is invoices for WB Mason, BD Associates, and Crystal Rock. Those are just our standard monthly things.
Mhm.
I would make a motion to approve.
Okay, I'll second.
All in favor?
Any discussion? Hearing none, all in favor?
Aye.
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 All right, approved.
And 2022 permit renewals. Installers, we have A. Ferrara, A.R. Plant, James Furtado, Reliable Excavators, Haulers, A. Ferrara again, Wind River, Hockomock Environment, Rubbish, we have United Hauling Waste Management, Body Art, we have Sacred Edition. The Sacred Edition is already addressed?
Yeah.
Okay.
So on the, yeah, the establishment itself, but then we have to do, we're gonna cross off Anthony Cologne.
Okay.
And
And
then-
Tony Ramirez is all set, correct?
Yes, yeah.
Is Tony Ramirez part of Sacred Edition, or is he,
Yep.
okay, all right. Because he was not on this,
Nope, I got his stuff in late.
okay, but it's all in,
Yep,
all right.
he's a renewal.
Anything to talk about these? We, pretty standard?
Yep.
Okay.
We're gonna actually, I'm sorry, I found out today that one of the people that submitted an application while I was on vacation actually is a new installer, and they cannot have that permit tonight. So we're gonna cross off A. Ferrara for installers.
Okay,
They can keep the haulers, because that does not require a test.
okay.
So motion to approve with the exclusion of A. Ferrara installers and Anthony Collin for Sacred Edition.
Second?
Any discussion? All in
Hearing none.
favor? Aye.
All in favor? Aye. I can say it loud enough so Rob can hear us.
Oh, Robert,
Did you hear that?
No, I didn't.
we're approving permit
I
renewals.
heard most of it. Let me just,
Approving permits except for Anthony
Ferrara for installers pending his test and Anthony Collin pending his documentation.
right, so those two are coming off, correct?
Yep.
Yes.
Okay. So if you're looking for a positive, so it would be aye if those, those two come off.
Yes, that's what we're saying.
Yep.
Okay, fantastic, approved. On to discussions.
Discussions, beavers.
That's a strange topic, huh?
It sure is. I learned so much last year.
You'd think that, but then again,
You can move up to the
Come on
table
up.
if you'd
Not
like
really,
to
I
have a
mean, I
mic.
guess I live next to a place where there's the lame beaver in the brook, so. So the water on the north side of Harvard Street is probably about 2 feet higher than normally it is.
Oh.
You just need to address your name.
Oh, my name,
Add
Brian Kendrew,
Just because we're on TV.
I live at 504 Harvard Street.
okay,
Sorry.
Which abuts all the wetlands
Mhm.
over there. I've been there since 2004. The last couple of years, it's changed. The whole area is flooding quite high. East Bridgewater put a structure in place to help trap some of the debris that was getting stuck into the culvert. So the culvert would get jammed and the road would flood. That happened once, I think in 2004 or 2007, a couple of times back then. So recently, it's been up a good 2 feet. If you go down there, you'll see it's 2 feet higher on the north side and it's lower on the other side,
okay,
which is causing a problem at my property. The sub pits where the pumps are, I'm always having water at the footings now. It never goes away. This is new, the last couple of years. So it's eroding the foundation of my house. I'd like to see maybe better controls put in place. And I'm not so sure if it's really all the beavers too, about, don't take this wrong when I bring this up about the Department of Public Works. I think they do great. Anytime I talk to them, they respond and return phone calls. I'm not sure of the timing, but I think it was like 2 or 3 years ago, They went down with that machine that cuts all the brush off the side of the road. It's got like a mower deck on hydraulics, and they chop everything. Well, they did that, and they just mowed all this stuff down, and it was all just in the water. And it just all floated down to the culvert and jammed it up. That's when I know things starting to happen. And another thing to think about too is with this control that was put in place, some kind of fence or wire to keep it from jamming the culvert, by keeping the water flooded, it's also now all these trees are always flooded. There's hundreds of trees on the north side, not thousands, but hundreds, and they're all gonna die. They're all gonna fall over. So now we're gonna create another mess of a bunch of trees heading towards the culvert. So if we don't address this, it'll become a lake and a mud pit over there.
So I remember previously, when the beaver issue arose, this is not entirely all our jurisdiction, Sue, is that correct? Like, we're responsible for the beavers, but not the actual,
So I guess if it threatens, health, with the standing water, then it's our jurisdiction. And, Bob did some extensive research and contracted with a gentleman out of Western Mass that came up with that device.
yep,
I think we have another one too over on Jones Pond. And we have a contract for maintenance with them.
Right.
And I did contact him, was it the spring or summer that you were in? And we had him go out and take a look, and we were looking at different ideas, and he did some measurements, and it was not a candidate area for another like leveling device like they have at Jones Pond. But I thought, I'm not sure if Jean Marie told me or somebody else that maybe the gentleman that does the beavers is off for the winter, or?
I got an email from the DPW that says he doesn't do the work in the winter,
Okay.
okay.
which, it's cold. I mean, you're in the water.
So, I mean, obviously, we're not beaver, we rely on someone like him to tell us what to do.
But as far as the flooding of the trees and the eroding of the soil, is that DPW or is it Board of Health? I think it's kind of like a grade.
That would,
As
DPW when it goes into
conservation,
the roadway, I mean, so
You
the
probably
DPW when it
need
goes
to
into the
go through
roadway.
Yeah, so, I mean, I see that you do have a problem. I just think that unfortunately your problem is gonna span 3 different boards.
Yeah, it's kind of complex, I understand.
Yeah,
right.
Especially when you're dealing with wetlands and conservation land. I think it is a life safety issue though too, because, if we get another storm like Andre, it was pretty messy over there. The road washes out, and God help somebody's having a heart attack, how you gonna get the ambulance, they're gonna go all the way around,
right.
so it creates some other emergency response issues, I believe. could
Yeah. I mean,
potentially.
I just don't know, like, I would assume possibly maybe conservation would be the lead, only because you can't really go in and dredge the area, because there's all kinds of guidelines with it being a wetland and all that, and disturbing ecosystems and all that, not
Yeah,
really
yeah.
my forte, but, I would think maybe that would also be like a focus for you to bring it to them, especially
I
if the
have.
trees are flooding and things like that.
I go to those meetings because they're building the houses next to me, which is also gonna displace water. So I've been going to those meetings and I brought it up. And really the only support I think I've been getting is here from.
Okay. Now, have you gotten any water in your basement or anything, or
Well,
it's just
I gotta run the
affecting-
pumps, I got a camera on there, I got 2 emergency generators, I'm ready for it, but, I'm not getting any younger. I
Yeah,
can keep
yeah.
doing this stuff.
Has anything that has been done relieved the problem even for a short time?
Yeah, I think, I think the fence helped,
Okay?
but now it's been flooding so much and nobody's been out there to maintain it because they're not out there, that the debris builds up. And so then the water level rises up.
Okay, it's not passing through.
Because nobody's cleaning it out. I mean, if somebody got out there with a backhoe or a grabber and just cleaned some of the material out, probably 2 or 3 times a year, I think you'd probably be okay. Long term, I think you need a better engineered solution made out of concrete that you can manage to clean out. Right now, there's like a 10 gauge galvanized fence material that was staked with regular green stakes in the ground. So that's what's out there. That's what's holding back all this debris right now.
And are you the only landowner in the area that it's affecting, or are your neighbors also affected?
No, I'm right next
Right on
to
the
it.
next-
I'm right next to it. The coots, they were on the other side. I know they were complaining, and so wasn't Wooded because they couldn't hay their fields. because they typically go down there and hay the fields. You know, and some things have changed there too, on the side, there's a cemetery, the old cemetery is there. And to the left of that is some kind of earthworks project that the Coots and the Watsons use. And there's a lot of dirt piled up there. I mean, you got mountains of dirt there. So I think that's even changed the topography of the water flow over there a little bit, so, I think it's not just the beavers, but it's stuff on the other side has changed too. You know, there's trees falling down on that side too.
Just doing a quick search, the last contact I had from Mr. Callahan was August 9th. And it said the current diversion fence is keeping the culverts unblocked as intended, but beavers need deeper water to survive our winters, so that is why they are damming up the fence. Clearing up the fence is a temporary measure only, as they will typically dam it back up that very night. The only way to eliminate damming in an area is to trap the beavers. The town's infrastructure is protected, so usually if it is a private concern, then they are responsible for paying for trapping. So that was August, Mr. Callahan. I'll forward that just so you guys have it.
Yeah.
You know, we can certainly reach back out to him just to say, you know, instead of, you know, I mean, obviously the DPW told us that he's not there, but we could certainly find out if
When
he's
he's
really
gonna
not working
start,
or when
yeah.
he could come.
I mean, that would kind of be our step one, is to try to see when he is gonna start working, and try to get him out there as soon as possible to see if he can figure something else out.
Is it possible, just an intermediate step, that the DPW could do something, get a piece of equipment out there and just pull out some of the debris?
I think that would be through DPW. I don't,
Conservation,
yeah,
Conservation,
that wouldn't
yeah.
really be handled by us, unfortunately, so you would have to reach out to them.
When I call the DPW, they tell me to call the Board of Health.
Yep.
So,
Yeah.
Well, I guess we could have
Something
Jean
circle?
Marie call and inquire that we've done due diligence on our end and that it's kind of passing the ball back to them and
Maybe
see
they
if
just
maybe
put
that
this
would help.
To stopgap measure until you can get a contractor out in the spring if he's not gonna do it in the winter. Because if we get another big storm, it's gonna be a mess. And then it's not, I don't know what's gonna happen in a few years from now when all those trees start topping over. You know, they're already doing it, they're already falling over. One thing that you mentioned in the email is that, you know, trapping the beavers. I worked at a company called AstraZeneca, you probably heard of it, it's in Waltham. It's on Winter Street, right next to the Cambridge Reservoir. I worked in facilities engineering. They had a beaver issue there, and I don't know all the details of what, I didn't run the project, but they were able to get a permit to knock down the beaver den and trap the beavers. I think they said they relocated them, I'm not sure. Because they had the same thing, they had a culvert that had the Hobbs broke one through there, and it was backing it up, and it was backing back at their site and screwing up the retention ponds and all the other controls in place. So they were able to do that, trap the beavers, relocate them, and clear them.
Yeah, I'm not sure, I mean, I remember it was very educational when all this was going on, but I believe that the thing was if the beavers were trapped, they would not be relocated, they would be euthanized, and that's when it came into the conservation component, because it's conservation, so, like I said, I don't know what the,
I don't know if it was
Implications
conservation or wetlands, but it was the Cambridge Reservoir. You know.
I think the bigger thing is we don't know if we can give you permission to do that.
Do
We
what?
don't, to do any trapping. We don't know who controls that land and whether or not who has the right to say
Yeah.
that we can trap the beavers or
Yeah.
not, until we
Yeah,
figure that
well,
out.
I'm not sure, I just know that it's damaging, who owns the culvert? The water that passes under Ovid Street, who owns that structure and maintaining that? Is that a state or a town?
It'd probably be town, but I really couldn't.
Because I think it
give
was
you a firm
rebuilt
answer.
recently, like maybe within the last 10 or 15
Her
years.
phone died.
oh.
We'd have to-
Yeah, I'm not sure, we'd have to look
We'd
into
have to look
that.
into that one.
Because
Okay, hold
then
on.
you go into like the area where if we could attribute it 100% to the beavers, then that would be your primary focus, but where there's all kinds of other issues that are compiling on top of it, it still kind of crosses different departments. But we can reach out to the person who did the beaver issue in the beginning and see when he's coming back to work in the spring and try to get him out there as soon as possible, maybe get a plan in the books. And then we can ask Jean Marie if she can call the DPW to maybe see if it's not our jurisdiction and they're keep passing it back to us, what the next step is for you. Because obviously you don't want to keep meeting with different boards and going, oh, well, it's not us, but
Well, it's all very interesting coming down to the town hall, meeting different You know, that's kind of the way I'm looking at it, and if we can get this solved, that would be great. I mean, I have a feeling there's other people who've experienced in this. I was at a
Yeah.
Conservation Commission meeting, and people further downstream, they're having issues too.
Right.
You know,
Yeah.
at least I don't have to run my pump 24/7. Some people are.
Yeah.
So I appreciate your time and anything you can do to help this. would be great.
Sure.
I guess what I'm hearing is you'll check with DPW and see if they'll do something, and
Yeah.
then this other contractor,
We'll find his start date for him.
yeah, and, you know,
No, they
maybe
don't.
maybe, I don't wanna give you guys more work to do, I know you got a lot to do with COVID and licenses
love
and
work.
stuff, but maybe we need to find a better contractor, one that has the equipment and resources that can manage this stuff, throughout the year.
I don't know if that is the issue. I don't necessarily, I think he's handling like just the beaver component. I don't think he's actually handling the water flow and whatnot. So I don't know if that is even his niche. I think he kind of was contracted to solve the problem with the beavers and the relocation and what we could do to not have to euthanize or whatnot. But
I'm
like
just
I
thinking,
said, I mean, if,
maintaining the, you know, debris will build up.
Right.
Like you said, so you gotta, somebody cleaned it up back in August, I don't know,
Did
sometime
you call
after.
Plymouth County Mosquito Control? I called them. Did they?
Something happened,
Yeah.
because within like a week or two after that, I just saw the water go
right,
right
Yeah.
down.
So I did call Plymouth County Mosquito Control back in August. You know, we had the triple E
because it's
in
stagnant,
West
yeah.
Nile,
maybe we can
so
approach
I
it
thought
from a
maybe that would be a
different way.
win-win. They could spray and check for blockages, so.
I mean, the smell is pretty bad down in the footing of my basement. I mean, you know, when the water's just, it doesn't smell good, you know? I got it capped, but I didn't take the cap off and it smells bad.
Well, stagnant water is gonna smell naturally.
Yeah.
There isn't much you can do about it.
Listen, what about this beaver fever thing too? That's a thing, right? I forget the technical name of it, but
Would you
there
say beaver fever?
beaver fever. There is a technical name for that. I can't remember what it is.
Is that
but
like
that's
cat
the-
scratch fever or something like
That's
that?
the
Not aware of that,
layman's
but-
term, but there is beavers do something in the water that create a disease that people can catch,
Okay.
and it's not healthy for them. I read about it, I just can't remember the actual technical name, but that might be another angle we can
Do a
pursue.
sample, yeah.
Can we talk to Conservation Committee and see?
Well, I was gonna say maybe
what
like
they
Jean Marie
have
and
on this?
Alex and John, or actually I think Rob Kent is kind of the lead on
The DP.
the beavers,
Yeah.
like that part, but maybe like Alex, Jean Marie and Rob need to have a powwow
Yep,
or
and
something,
just-
you know?
just-
True.
Who controls the land? Who gives the permits? If
Yeah,
that's the way
instead
we're
of
going.
sending everyone everywhere,
And
you know?
just-
So we can definitely start the ball rolling and try to, like I said, reach out to the person who handled the beavers originally and see when his start date is. I would assume it's probably, you know, the early spring, but if we get a hold of him ahead of time, maybe we can get him out sooner than later before everything thaws and whatnot.
Yeah. Or, you know, just have somebody, you know, with a backhoe clear some of the material out, just so the water can go down again, because it's
That
pretty
will
high
require
right now, it's very
conservation.
high.
That's, yeah, this
Yeah.
is where we, yeah.
That goes right back to conservation.
Right away, it goes right to conservation, because it's a conservation issue.
Yeah.
So.
Maybe
that's-
they'll approve that.
We're gonna talk to all three, and,
So anything I can do to help you guys, let me know, you know, you ain't volunteering to do anything around here, I got time on my hands, and anything that I can do to help, if you're helping me, I'll help you.
Well, thank you for
I'll
that.
try.
Okay, thank you.
Do you have his contact? Sue?
Yeah.
You must have his,
Yeah.
yeah?
Yep.
Yeah.
Get back to him. All right, I just want to make sure we had your number and your
Yep.
contact, so we're all set.
All right,
We'll let you know. Thank you for coming in.
thank
good
you.
luck with your more challenging COVID issues.
Thank you.
All right, next for discussion is the COVID test distribution.
Actually, if you just look on my update, I kind of,
Covered it.
Okay.
well, any comments or concerns from you folks? It was kind of, we had 2 drive-through deliveries of the rapid test kits. They were delivered December 26th at 7:45. After 3 or 4 different sites, I looked on Facebook and found out we were doing it at the Council on Aging on the 23rd. Around 2,000 test kits were handed out in about 45 minutes. We put some in the Meals on Wheels for delivery to shut-ins. They got 1 test kit apiece. 25 veterans and widows received them through Veteran Services with Christopher. 210 went to town employees through department heads. And the only problem I had was when I went up to help, they wouldn't let me through the line. I had to sit in line. And then I was in the wrong line, so I had to switch to the Plymouth Street line. and I didn't get in there in time to do anything.
All right.
And Rob had the same sort of issues, even though I had a screaming yellow bright jacket that said public health on the back and a business card. The policemen were very strict. I was not an East Bridgewater resident,
You
so
need to be more vocal so that they know
I
who you
couldn't,
are now.
I couldn't get through. So, traffic was a concern with that. The police did a very good job. It was just a mad rush at times. The second one, we got on December 30th at 8:45, and we distributed them January 1st, New Year's Day. It was a handed out drive-through at the high school. We had 1,000 handed out in about 47 minutes. It's rainy, but it was done well. The CERT team was very good and easy to work with. I did get into that site and did hand out lots of kits. 288 test kits were given to the Housing Authority for the handicapped and elderly, with 1 or 2 test kits going to each unit over there, depending on how many people were in it. 25 more test kits to the Veteran Services for Christopher to hand out. Traffic was much better, but it's still backed up. And there were some concerns. The most concerns being a decision was made by the incident commander to open the test sites early. We only had enough for around between 250 and 300 cars each time.
Mhm.
Do you make them wait the hour and a half till the 1 o'clock timeframe?
No, I did
Would
want
you
to address that
still
too
wanna
with the
give out-
public, to let them know that it was, although the town purchased as many as they could, I did read a lot of things on social media where, people said it was supposed to start at 1 and it started at 11:30. I believe the call was that whether they started at 1 or 11:30, it was still going to be those people in line that got the test. It was just going to impact traffic. So it wasn't that we stated a time and then falsely started 2 hours early. When you have 20 cars, those 20 cars are going to get the first 20 tests, and so on and so forth. So it was just difficult. We tried to do something to facilitate the public as best we could in the town, and it was unfortunate we didn't have tests for everybody, but we did the best that we could. And people volunteered both those times to pass those tests out. Thank you, Jean.
So if I'm reading this right, Jean Marie, we handed out 3,000 test kits over the course of 2 days in a little over an hour,
Yep,
all purchased by the town,
yes.
not given to us by the state.
No, we were not eligible for
Right,
the
we didn't
free test
qualify.
kits. And
The town
we-
purchased them and handed them out to the town residents.
We made a
for
decision
free.
to try and get them out during the holidays rather than
Mhm.
wait until the end of January when we were gonna maybe get some free kits.
Okay,
Yep,
excellent,
that was, this-
excellent.
Great.
3,000 test kits in over an hour? I don't see why you can complain about that.
just keep your toes out of the way.
Just keep your toes out of the way.
Budget, do we have anything on the?
So I put that on there because I hadn't, Rob and Jean Marie had been working on the budget while I was on vacation, but they did, and I will forward that to your email also. I'll wait till, I don't want to hang up on Rob.
Yeah.
So we did come up with the final budget. It's the only thing that I think what they did was they moved the money from the health services, like we talked about at the last meeting when we had that preliminary budget, into nursing and Jean Marie's line item to try to increase the nursing line item to get more hours, and then obviously, we have to increase Jean Marie's salary line item. So other than that, it was just, got rid, like, Bob's longevity, we did, he retired, so we didn't need that anymore, and things like that, so. But I'll forward you a copy as soon as we're done with the call, so I don't hang up on Rob accidentally.
Okay.
Thank you.
Hey, you're running out our charges tonight.
And our liaison, I should say, is Crystal Hudson, so she'll call either Jean Marie or Rob or both of them to get together to talk about the
If
budget.
I could just interject real quick here, I know we moved off the drive-through, but I just want to recognize both Sue and Jean Marie for their efforts, and also coming out the night before to meet the truck. And Sue, did your husband come out with too as well?
He came out the first one, yeah.
Yeah.
I just, it's one of the great things about being in a small town is, all the different departments and the folks and the volunteers and everybody just working together to pull this off. And, Matt, I think you just, put some numbers together and how many kits we moved in a matter of total of 2 hours. and that just goes to shows the cooperation amongst all the departments, the folks in town, and just everybody trying to do the right thing for the folks of East Bridgewater. So I just wanted to, thank you guys again.
You're welcome.
Excellent. Jean Marie?
Back to health agents update. So we went through the test kits. We had 3 septic systems installed and COCs issued, 45 Hidden Acres, 367 Winter Street, and 297 West Union Street, just in case you're wondering what's going on. I have 2 septic systems going in progress now, 20 Arrow Path Road and 197 Plymouth Street. So if you get questions, that's what we're doing. I have 2 body art inspections for this week. One we talked about for Sacred Edition, and tomorrow I'm doing Mass Ink. And just to let you know, the Maven contract tracing, we were doing about 7 or 8 a day at Thanksgiving time. We're hitting 198 to over 250 the last week. The system has crashed a number of times, and we've both gotten locked out of it a number of times because it just got overloaded. I also did emergency closures of Dunkin' Donuts. Was 3 visits on Saturday, Sunday, and today.
Same location.
Yep, yep,
Are they open now?
yes, they are. And they're clean. It's not uncommon. They had a fruit fly infestation, and it happens this time of year with bananas and mangoes and things that come in that are very ripe and very tasty to fruit flies. So it's just a matter of shutting down, getting rid of them, cleaning up, and reopening. That's it for my,
All right. Meeting schedules?
So,
Martin Luther King Day, is that?
so we met today because next week's Martin Luther King Day. But then President's Day is also the 3rd Monday. So I did talk to Rob earlier, and, obviously not knowing if we were gonna need to have a meeting quick for the body art, or if talk about any other things that are gonna be important with COVID. But it looks like January's got 5 Mondays. I can't see the calendar
It
for
does.
this year. So I don't know if you guys wanna, see if we can reserve this room at 5 o'clock. We should be able to for the 4th Monday. And then we'll get back onto the 1st Monday of
Yes.
February.
I think we
That
should.
works for me.
All right, and I think that shouldn't be an issue. 5 o'clock is usually not a popular time for meetings.
Does that work for Rob?
Rob, 24th at 5, good for you?
Sounds good.
All right, so that brings us to the last item for discussion is topics not reasonably anticipated.
Okay. You want to talk about this COVID surge we've got going on in town?
and tie it into mask?
Well, we can tie it into mask. Let's talk about the surge first, so people are up to date with what exactly is going on.
I sent you guys all an email earlier. I think it was around somewhere in between like 340 cases since January 1st. That's of people that went to a site to get tested. So throw on top of that all the home tests, the 2,000 tests that we gave out. We've been fielding, both of us, and Heather has told me she fielded calls all weekend from people that did home tests that tested positive. So that number is not even included in there. So probably almost double it, I wouldn't be surprised. So, I know Jean Marie and I were both finding people, once it hits one person in the household, it's the entire household. It's super contagious. All kinds of the symptoms are all over the map. The guidance has obviously just changed, so that's causing a lot of confusion for people. So we're getting a lot of calls on that. We did just ask the selectmen today, so the guidance is on our website, but we asked the selectmen to put it like right there on the front of the Town of East Bridgewater website. And so people can find it there. We also asked them to mention that at their meeting tonight, that people can find it there, because a lot of people are just struggling to find out like what is the actual guidance now, So, yeah, it's been crazy.
So why don't we talk about the guidance real quick right now, what day is day 0, what day is day 5, and what they're supposed to do on day 5, just so we're all clear as to how that goes.
Okay, well, the recommended guidance is 3 different areas, right? If you're vaccinated and you test positive, you are asked to stay in isolation for 5 days, and day 0 starts the day that you get symptoms and/or test positive.
Okay.
And day 5 you stay in, and day 6 you can go out for the next 5 days as long as you mask.
Is there
That means
anything,
close contact.
is there anything in that guidance that involves symptoms?
If you have symptoms, you
Stay home.
Stay home. Stay home until the symptoms
So if you are
subside.
sick, stay home?
If you are sick, stay home.
All right.
I think basically that's what we discussed earlier.
Yeah.
That's kind of the premise, and as a healthcare worker, I'll tell you, you may not think you have COVID, you may have COVID. Just because you test negative doesn't mean that you're COVID-free. It could just be that your viral load is low. If you're sick, you stay home. If your sickness persists, you should test. Otherwise, you're contaminating others. The guidelines, like we all know, they're changing weekly. I think they're changing more on the fact of supply and demand of workforce as opposed to what the actual health component could be. But bottom line is, whether it's day 1, day 5, day 14, if you still have symptoms, including a fever, and the symptoms for Omicron, like we were discussing earlier, are very varied. It's diarrhea, like a lot of them have back pain. So any type of thing that you would consider, oh no, allergy. I've had several coworkers that thought they had allergies and they tested positive. But bottom line, if you're sick, stay home.
Please.
Yeah, please.
Yeah.
Jim Marie, what about the other two levels of guidance from,
Well, the other two levels are if you're not vaccinated, it's still,
Nope, so anyone that tests positive, vaccinated or not, is what we just talked about.
Yeah.
The 5 days and 5 days with a mask. And then unvaccinated, so they've reduced the quarantine for everyone. If you're vaccinated and it's been more than 6 months since your vaccine, you kind of fall into the same criteria as unvaccinated now, and that's stay home for 5 days and then go back to work, assuming you have not developed any symptoms, for the next 5 days with a mask. If you've been boosted, you only need to quarantine if you become symptomatic. And all of the guidance now says, recommends a test, doesn't require a test, probably because no one can find a
line
test.
tests?
Right.
So before it was like test on day 5, but, now you can't really find a test. So that's now more of a recommendation. If you can get your hands on a home test, day 5 is a good day to take a test if you've been exposed. And obviously, if you're positive, then stay home.
You mentioned boosters. Is there any chance the town is doing a booster clinic? in
Oh,
the next couple
we should have
months?
probably put that in our updates, huh, Jean Marie?
oh yeah, that would have
It's been
been,
busy today.
some things are so,
Yeah.
Right, I got you.
So I know
Yeah.
the teachers
Thank
are
you.
doing the
I
12th.
gotcha.
Is
So the
that
teachers are the 14th. I think they're are they Friday?
this week something?
Yeah,
the
yeah.
public clinic is January 13th at the Council on Aging. Go on website and you can make an appointment. Okay, you have to have an appointment to go to that.
For boosters?
For boosters.
Okay. Any age?
Any-
It's over, I believe it's over 12, yeah. So, yeah,
12,
anyone that's
I know that
eligible,
there was
yeah.
a lot of, I've gotten a lot of comments about,
It was
5
over
to 11s
16,
aren't
and
there
then,
yet.
yeah, that the 12 and up.
just Thursday it happened, that they
Yeah.
The
approved it.
school is offering one for the staff, but they were wondering if the Board of Health was going to try to implement something for that particular age bracket, the 12 to 18, that just became eligible for booster.
They can
Well,
go
we
on.
are, because they are available, they can go to the one we're doing.
Yeah, and I did actually ask Karen Clifford when I talked to her about the school one, like, hey, can the kids go too? But I think they scheduled it at such a time that was convenient for the teachers. I think it's like maybe a professional day or something
Yeah.
like
Yeah,
that.
it is.
But this pharmacist that's doing ours is also doing theirs, and probably between us or the school, I actually got her name from the school nurse,
There are
Amy.
two more within,
Yeah.
I know there's one on the my
Yeah.
phone is dead, but I know West Bridgewater and I
Yes.
think Hanson
Yep.
are doing one next week as well for
Yep.
boosters, and it's not town residents only, you
Yep.
just have to go on the website.
Yep.
And make an appointment.
Yeah, that was gonna mention that West Bridgewater actually, so Rob Casper actually called us on Friday, asked us for who we used. He was able to hook up with her also, and they're having a booster clinic. So, and because it's not run by the town, we really can't say, residents only, so.
Can we put that information out on our website so that people know where to find these various booster clinics in
Yep.
case they
Sure,
can't make the
yeah.
one we have in town?
Yep.
Yep, the booster, the one, obviously the school one is private, so we can't really put
Right.
that out, but
Yep.
the one we have is, everywhere right now too.
Yep. Okay.
And you still can get them, I know, Shaw's has been limited, but I know I just went on to CVS
CVS is,
in West
yeah.
Bridgewater to get my son's next dose, and I got an appointment for Wednesday, so they're not like super spread out that you have to wait a long time.
No, I think I'm going on a Friday to get both my flu and booster shot.
On the same day?
I tried to get my flu and they wouldn't give me, they were out of the flu shot.
Actually, while we're on boosters, I just want to mention too, on television, not that we have a big viewing audience, but
There are
We've had a lot of
dozens of
calls
people
this week
watching
about
this.
people that were just exposed, unvaccinated, or just had their first shot in their contacts, and they want to know, can they still go get their second shot? They really have to fulfill their quarantine before they, number one, they may not feel so well after their second shot if they inadvertently have COVID.
Right.
But, then they've just gone into a clinic and exposed people, so.
I know it was, and it may have changed, but I know for my patients, if you were positive, they made you wait almost 21 days. So
To make
it was-
sure.
it was longer than the
Yeah.
14-day quarantine. And the same thing with the booster. I believe it's still 6 months from your last COVID shot.
They moved Pfizer up to 5
5.
months. I'm not sure about
5,
Moderna,
yeah.
yeah.
They just changed this weekend.
So that's been one of the popular questions this week, so.
So what about masks in the buildings? Let's talk about that.
That we're still on a recommendation that you wear a mask when you come into any public building in East Bridgewater. West Bridgewater doesn't have such a recommendation. Many of us are actually double masking using either an N95 or a surgical mask under a cloth mask,
Okay.
because this variant seems to be a smaller virus particle.
So can we make motions in this section or no? This is the issue we have, the question.
So I don't know not a lawyer, so I don't know the legality of, because it's obviously not on the agenda. I don't know the answer to that. I don't know, Jean Marie, you have any experience with that?
Yeah.
What was Matt's question?
Can we make a motion for something that's not specifically on the agenda?
Now, this I thought would fall under,
Yep.
Topics
Yeah.
not anticipated?
Right, things not anticipated, and I'm under the strong opinion that with the spike over the weekend, it was just something I'm under the impression or opinion that it needs to be discussed, and it's something that, even though we knew it was gonna be tough, but we just didn't know it was gonna be this bad. We talked briefly about, I shouldn't say briefly, actually, in depth about the numbers who, like you had, what was it, 334?
Yeah.
Plus there was a home test. Then there are folks that may just think they have a cold. And they're borderline asymptomatic and not testing because they don't know they should test. So that you put a number that might even be double what's reported. It could be a lot higher than that from people just not testing and not realizing that they have it. So if you're boosted and you're relatively asymptomatic, you still could be passing this virus along. Lisa, am I correct in that?
Yes.
So,
The vaccine and the booster has no effect on contracting or passing on. It only diminishes the recipient's symptoms in most cases.
so this is something that has grown far greater than what we would have anticipated. Hence, it's not on not on the agenda. But we just need to kind of talk through this. I know it's not, but I do think it's something that's of vital importance. Enough to have a discussion. But again, I'm not chairing the meeting tonight. But I do think it's something that we should be able to take action on.
So we talked about this at our last meeting, and the general problem I know I had with it, and also Lisa had with it, and Lisa can correct me if I'm wrong, was that there was an issue with enforcement
Correct.
on who was going, if we decided to whether we make a recommendation to the Board of Selectmen or make one ourselves, who enforces anything we do here? We don't want to put anybody in a position where they're trying to enforce a mandate or a rule against people that are forcefully, willingly against that rule. And that became an issue, might become an issue. It was something that we were concerned with. I think that we've hit a point where we got to be talking about whether or not people are wearing masks in the buildings. We don't control the buildings. The Board of Selectmen control the buildings. So if allowed, I would make a motion that we recommend to the Board of Selectmen that they institute a mask mandate in town-operated buildings to be enforced by the department heads in the buildings that they own, and the designated the Board of Selectmen and the buildings that don't have department heads. And that the mandate language should include that employees can remain unmasked when they're at their workstations alone for now, and, you know, to be updated later.
Did you catch all that, Rob?
I did catch most of it, yes, yep.
So, is the motion, would a motion be allowed, Rob, and we have a second?
So if somebody puts that motion forward, I will second it.
I just did.
Then I have 5 seconds.
All right. Any discussion?
So I'm confused.
Sure.
So we're making
Nope.
a motion for
I
mask mandate?
we're making a motion to recommend that the Board of Selectmen mandate masks in town buildings, because it's their building.
All right, so we're just passing the ball to the Board of Selectmen?
Given, they have the enforcement hands, it's their building, we suggest that it's a good idea that they do this, and then they can decide how they want to handle it, but it, you know, hey, here you go. Because I certainly can't sit in the front hall and tell people to wear a mask all day long. It's not my building.
Right. So a second?
That Rob seconded, yep.
Yeah.
Yep, any further discussion? Okay, all's in favor? Aye. Opposed? Passes unanimously.
And I guess that wraps it up. No other, Rob, you're all set?
Just, hey, Matt, and
Yeah.
Lisa, thank you very much for helping out. I really appreciate you guys stepping up. Can't always make them.
Okay,
And I just want to say one thing while we're on camera.
Sure.
I just want to thank Karen Lynch. So Karen is, people might know her from back in the day. If you grew up here, she was a central school nurse at the school when we were younger. She worked for Partners Home Care and did a lot of filling in here for us when we had Partners Home Care when Doreen Zeller was our nurse. She most recently did some part-time contact tracing for the town of Whitman. And she, as a resident of East Bridgewater, graciously stepped up and is volunteering on her own time to do some contact tracing for us because she already has Maven credentials and didn't need to be trained, and has logged in and done cases on the weekend for us, and is still doing Whitman at the same time, you know, for no compensation. So I just want to, you know, say thank you to Karen for helping us out. It's been great.
good. Jim Ray, anything?
I'm all set.
Good. Take a motion to adjourn.
Motion?
Seconded, all's in favor?
Aye.
Aye.
All right.
All right, passes.